Ambulatory blood pressure monitoring, ABM, ABPM. 24 hours blood pressure measurement gives a picture which is really true. Blood pressure fluctuates because of the fluctuation of the renin, angiotensin, aldosterone mechanism, NADH, ANP, BNP, and other few peptides. They fluctuate. So, in sympathetic nervous system, they also fluctuate. So, thereby, BP fluctuates. And to confirm the BP, you in the faster time, you need to do at times repeated BP. Another way of confirmation of blood pressure is your ambulatory blood pressure monitoring. 24 hours record, nighttime, daytime, when you will really choose these things to confirm hypertension when you are not certain, and to differentiate between the primary and secondary hypertension, and when you have higher amount of the white coat hypertension. In fact, 25% to 65% of the average 40% of the hypertension are white coat. And mass hypertension is very common. We couldn't appreciate these things in our early days. CKD, obesity, diabetes mellitus, obstructive sleep apnea syndrome, and transplant, single kidney, coarctation, and history of prematurity. Plenty of other conditions are there where you do have masked hypertension. BP low in clinic, in being high, in the home BP it is higher. So, and unrecognized hypertension causes organ damage and death. In fact, 50% of the hypertension go unrecognized, and they have higher amount of all-cause mortality. So, and before leveling the your high with refractory BP means 2 or 3 antihypertensive not able to control the BP, and pseudo resistance, no response. Basically, the non-compliance is more important. So thereby, using Western data is 50 to 80% non-compliance causing so-called pseudo resistance. So it is to be checked before leveling pseudo resistance. So these are the situations: resistant hypertension, pseudo resistant, masked, white coat, and predisposing factors. When you are not certain, in absence of dipping, it's another important thing. Usually night BP falls by 10%. Normal dipping, when it doesn't occur, you have higher amount. Non-dippers has higher amount of cardiovascular events and death. Thereby, this BP must be measured, and actual BP should be known, and it should be have control throughout the day and night. This is not lifelong. In the desired level, in the lower normal usually. So chronic hypertension is common, and damage is more common, and you have higher amount of death, over 60% more death in the by CV events. So how do you do these things? How do you measure the ABPM? You have oscillometric or oscillatory method, the device which is validated for children. You wear it you give it to a patient on the non-dominant hand, that is left hand. You record the BP in the daytime, 15 to 20 minutes interval, and the wake time and the sleep time you record in 20 to 30 minutes interval. Then about the successful reading, 70% suppose, of which 40%, if you record, it comes how much as one reading per hour. So it's nice. So, and you exclude the exclude the outliers like the systolic BP too low, less than 60 ml, too high, less than two, more than 220 millimeter mercury, diastolic BP less than 35, more than 120, the pulse beat less than 40, and more than 120, and take those things as an difficult, and then so exclude those outliers and take the normal values in between and see the level of BP. This is the normal BP, like it's nothing white coat, nothing masked, and then it's actual BP, and then go on maintaining the antihypertensive 1, 2, 3, whatever lifestyle modification to control this blood pressure to the desired level.